that led me to think about parasites. Well, of course, we talked about it a little bit when I did my functional medicine training, but really it was this book right here, The Accidental Cure. If you haven't read this book, it's incredible, because what it talks about is people who, there was a Dr. Simon Yu, is a physician in St. Louis who used to work for the Army. And so he would go around to these third world countries and provide parasite treatment because, as I said in the last video, over 1/3 of the world is troubled by parasites, and you and I are not immune to this. So what he noticed is that people were getting better from other things when you would treat them for parasites. And it is not surprising that now much of cancer treatment, we use parasite medicine for cancer now. Why is that? Well, when your body has an invader, it will try and create a wall. It will try and wall things off. And so, it's my feeling, because parasite treatment is really, really safe, that if I ever got cancer, the first thing that I would be doing an intensive parasite regimen, just on the off chance, because the connection has not been, well, the connection has only been made in some cases. There certainly have been people who were recognized to have cancer, then got treated for parasites, and the cancer went away. That's why now they're using, ivermectin as a cancer treatment. So how would you treat for parasites if you're going to think about doing it? What's nice is you don't have to use medications. Although I wanted to learn how to do this a little better, so I went and spent 3 days with Dr. Simon Yu in St. Louis. And when I learned Dr. Yu's protocol, he was using pretty high doses of antiparasitics in order to treat people. And so that is certainly something that you can do. The problem is when you use the conventional doses for parasite treatment. My experience, it's just not quite enough. And so I actually will do triple therapy. And I use ivermectin, tinidazole, and rhesus pinworm medicine at higher doses in order to help clear people for 10 days. So I always have to write a little note.
This next recording from the
I always have to write a little note to the pharmacist that say, hey, these doses are going to be higher than what you're used to. We're using off-label parasite treatment. But you don't have to do that, because the herbals can be extremely effective. And so I started to use something called CellCore. Also want to mention that there's a really neat guy named Dr. Raphael who has something called Para Wellness Research. And Para Wellness Research, he's a retired holistic doctor who focused on parasites, and you can actually order parasite testing through his group. And then he'll give you thoughts on how you could treat it. Okay. But it's a membership site. So you have to join his membership. And I feel like he's, the only problem that I see with that group is that parasites are hard to test for, and because they're cyclic. So I, like, let's say today the parasites are not active, or they're in a form where I'm not shedding if I had parasites, which I'm sure I do actually. So pretty much everybody does. You know, then the stool will not reflect that. And so stool tests may not be accurate. Some of these are better shown through blood testing, although most that we're talking about really are stool testing. But that is called Para Wellness Research. I actually put the link below in the description if you want to look into that. So when I was at Dr. Yu's thing, the way he would diagnose is using a technique that looked at all of the different acupuncture meridians electrically. So he would take this device and he would measure the conductivity at all of these different acupuncture points. And then he could say, well, if people had significant trouble along like the gallbladder meridian, the stomach meridian, or things related to the gut, he would say, yeah, likely there's an issue, and then he would treat with this protocol. Because parasite treatment is pretty darn safe. I mean, you got to check with your doctor. Um, but I feel like it is low risk relative to the potential benefits. And so some people I will give the conventional treatment, and I go with Dr. Yu's style. And other people I would say, you can do a DIY protocol through, that I can sort of guide you through using a Cellcore Biosciences uh, protocol. So Cellcore, I think so below, I've also linked a sheet that I have that's about how to treat for parasites, right? And if you were curious about what I would say to consider, you can click on that link and you can read it. Some people will treat for parasites right around the full moon. And Mimosa pudica is a commonly used treatment, and Mimosa pudica is part of Cellcore's protocols. They have several different ones. One is called the Para Kit. The Para Kit has a binder, and it's very important if you're going to treat for parasites, you need to have a binder to sort of like catch anything that you kill, right? So that because when you kill parasites, they're obviously when they die, they can spill contents that can be inflammatory. And so you want to start slowly. With the Paracate, you can do a 3-day, sort of a beginner, or a longer one, 5-day or 7-day. And the dosing will go up if you're doing these longer longer sequences of treatment, and you do it around the full moon. So Para 1 is what has Mimosa pudica seed. They have several different supplements. Para 2 is herbs. It's like got Triphala, Neem, Vedanga, Pudajara, and it also, they have this thing that they call carbon technology that is supposed to support the immune system and digestive system, as well as help with killing parasites. And then they have something called Para 3. And Para 3, it gets more intracellular parasites. And it is pretty powerful stuff. So if you're sensitive, you want to start slowly with these things. And what's nice about their protocols at Cellcore is that you can dial them down. If you're sensitive, you can always dial them down. Now, if you have complex medical illness, like a lot of things going on, and then they have something called the foundational protocol and the comprehensive. If you got a lot of stuff going on, the comprehensive protocol, it takes several months to walk people through that. And if you're interested in doing these longer protocols, the foundational is about 4 months. The comprehensive is 5 or more months. And the comprehensive protocol also covers stealth infections too. So if you're like, I wonder if I have Lyme disease, I wonder if I have something like that, the comprehensive protocol is more likely to be preferable for you. So why do we treat around the full moon? It appears that parasites are more effective during the full moon. If you're using those bigger protocols that are longer, Cellcore actually spends a couple of months on trying to get your gut right. And so there's 2 months that are devoted to trying to get rid of parasites. Now, we always see things in your stool, not necessarily, you may not. Sometimes they're very small. And is everything that you see that looks like a worm? Not necessarily, because it also, the herbal supplements and the Mimosa pudica almost scrubs your insides. So you can have sloughing off of of, material from the lining of not the good stuff, like cleaning it off in a good way. It's sloughing off the lining um, of your intestines to try and make it so absorption will be better. Because the fact is that when people have parasites, they just don't absorb nutrients near as well. I mean, you can have vitamin A, vitamin B12, copper, iron, magnesium, zinc, all of these can be low when you are affected by parasites. And so I think it's important to think about, and unfortunately, in conventional medicine, we really aren't taught about it. Naturopaths, you guys get all that learning. I know. I'm sure in acupuncture, probably they talk about it too. But in functional medicine, we learn about these things a little bit more than back. I mean, in medical school, you do learn about parasites. So not that you don't learn, but then it's sort of like it's just not emphasized as a potential issue. And as you guys saw yesterday, if you watched the video from that told all of the different potential problems you can have with parasites, holy moly, it's incredible. So reach out to me, DM me if you would like to know more about how you could walk through and how I could guide you through, it's like a longer self-war protocol. If you're interested in that, just shoot me a thing, a little message, and I'm happy to help you. And have an awesome